Okay, well, I'll go ahead and get started with introductions. So if everyone, if you would all please turn on your video just so we can see everyone as we're introducing our speaker. This session is on climate health and equity, a call for action. And our speaker today is Dr. Linda Rudolph. Dr. Rudolph is a nationally recognized thought leader on the integration of health equity into climate policy. She serves as the senior advisor on climate health and equity for the Public Health Institute and for the Medical Society Consortium on climate and health, and provides consultation to local jurisdictions and nonprofits. Previously, she served as a deputy director for chronic disease prevention and public health in the California Department of Public Health, and the health officer and public health director for the City of Berkeley, California. While at CDPH, Rudolph served as the founding chair of the California Strategic Growth Council's Health in All Policies Task Force and the California Climate Action Team's Public Health Work Group. She has also served as a chief medical officer for Medi-Cal Managed Care, the medical director for the California Division for Workers' Compensation, and a physician for the Oil, Chemical, and Atomic Workers International Union. Dr. Rudolph received her MD from the University of California, San Francisco, and her MPH in epidemiology from UC Berkeley. She is a board certified physician in occupational medicine. So I will go ahead and hand it off to Dr. Rudolph to begin her presentation.
Thanks so much, Tate. And thanks to Joy and Arjun and the other organizers of this conference. I am really thrilled that there's so many of you that are taking a Saturday to talk about the climate crisis. And I really appreciate the opportunity to talk about the nexus of climate health and equity and the role of health professionals in addressing the climate crisis. Next. You are all familiar with the stark health inequities that result from systemic and such structural differences in the environments in which people live, work, study, play, and pray. Next. And you know that these health inequities persist in Oklahoma and around the nation. And these inequities provide the backdrop for the worsening impacts of climate change on health. As you see next. At the top of this graphic that I will use throughout this presentation, where it's just showing that living conditions drive health outcomes and health inequities. Next. I'm sure you're also all familiar with the sources of the greenhouse gas emissions that are trapping heat in our atmosphere and causing global warming: our energy, transportation, land use, food and agriculture, building and housing systems. Next. There have been dozens of recent studies and reports in which the world's leading scientists and health professionals have detailed the impacts of climate change on health. Next. So I want to just walk through what all of these reports, along with, hundreds and hundreds of articles in the peer-reviewed literature. Let's look at what these reports say. First, that climate change is impacting our health now. Next. This video from the Centers for Disease Control summarizes how climate pollution leads to higher temperatures, rising seas, more extreme weather. And these environmental impacts in turn cause an array of environmental changes that are associated with a wide range of impacts on human health. Next. And we show that here in the bottom row. Greenhouse gas emissions cause environmental changes that cause climate health impacts and climate health inequities. Next, the reports also document that climate health impacts are greater in communities of color and low-income communities, thus widening health inequities. Why? Next, there are several components of climate vulnerability. To what extent are people exposed to climate threats? Coastal communities are obviously at greater risk from sea level rise than you are in Oklahoma. Agricultural workers are at greater risk from heat and from vector-borne disease. Next, some individuals are more sensitive to climate threats due to physiological differences. For example, the very young, elderly, pregnant women. Those with pre-existing health conditions such as heart and lung disease or diabetes are also at higher risk. This means that communities with higher baseline prevalence of chronic illness are at higher risk of climate-related health impacts. Next. And of course, the capacity to adapt to and respond to climate threats also affects our vulnerability to climate impacts. People with air conditioning are more vulnerable to heat illness. People in neighborhoods with aging and poor stormwater infrastructure are more vulnerable to flood impacts. Those with home insurance are more able to rebuild after a disaster, etc. Next. Together, these differences in vulnerability and exposure result in what my colleague Rachel Morello-Frosch calls the climate gap. This map from the California Department of Public Health, for example, shows differences in climate health vulnerability in Los Angeles County. And this map could also be a map of health inequities in Los Angeles County. Let's look quickly at a few specific manifestations of the climate gap. Next. Extreme heat is the leading cause of weather-related deaths. In fact, scientists forecast that dangerous heat days in Oklahoma will nearly double by 2050, and that summers in Oklahoma City will look like summers in Laredo, Texas look now. Next. As mentioned, outdoor workers, especially in physically demanding jobs like farm work, are at very high risk from heat illness. Urban heat islands, areas that have dense buildings, dense populations, lots of impermeable surfaces, and limited green space, can see temperatures as high as 22 degrees Fahrenheit, higher than greener areas. And we know now that urban heat islands map to areas of historical residential segregation. Studies have shown that people living in poverty are often unable to maintain air conditioners in working condition, or don't turn on their air conditioners for fear of high utility bills. Next. Higher temperatures are almost linearly associated with higher ozone or smog levels that exacerbate asthma. So communities with higher asthma rates, for example, people living near busy roadways, are at higher risk in heat because of these knock-on effects on ozone. Next. Particulate matter, which is associated largely with fossil fuel combustion and now with wildfires, is particularly dangerous to health. Next. Wildfire smoke travels hundreds of miles. Recent studies suggest that wildfire smoke now contributes about half of California's exposure to particulate matter. Families unable to afford high quality air filters are especially at risk when wildfire smoke persists over weeks. And I don't know whether Oklahoma experienced high smoke levels from the California wildfires last summer, but I know that my colleagues in Washington, DC were complaining to me about how our wildfires were causing their smoke, their air to be dirty. Next. People with heart or lung disease, children, and pregnant women are at especially high risk from particulate matter, which has now been associated with adverse birth outcomes. And there's an increasing body of evidence suggesting that particulate matter is associated with changes in cognitive development in very young children, and also with cognitive decline later in life. So yet again, communities of color and low-income communities with high baseline rates of chronic illness are disproportionately affected. Next. Drought impacts are greatest in communities with tenuous water supplies and for low-income people who cannot easily afford bottled water. These pictures show community shower station and community water pickup station that were set up by local public health agencies in California's Central Valley during our last big drought, when hundreds of households, especially those in very small community water systems or those that relied on private wells, simply saw their taps run dry. And Oklahoma, as you know, is at very high risk of increasing drought. Next. Native American communities who rely on traditional food systems and ceremonial plants, and who often live in areas that have limited water access, are at highest risk due to the impacts of heat and drought. Next. Just continuing on in terms of how these climate health impacts really drive health inequities as well. Outdoor workers and people without well-maintained window screens are at increased risk of vector-borne diseases. And several years ago, I had the opportunity to work with the Environmental Health Department in Tulsa. They were very concerned that they saw that the changes in climate were driving the Aedes aegypti mosquito that carries Zika virus that causes very serious microcephaly and other birth defects, was expected to move northward as climate allows an expanded habitat for that species of mosquito. And they were concerned that they needed to adopt really new approaches to trapping mosquitoes to be able to identify the Aedes aegypti mosquito and respond to it appropriately. And similarly, we worked with the New Orleans Health Department. That was the first health department in the US that really had to deal with finding Aedes aegypti mosquito in the continental US. Next. And climate change has very significant impacts on mental health that are both associated with the trauma of extreme events such as flooding or wildfire, and with emerging climate anxiety, which psychologists and psychiatrists report seeing particularly in youth who are concerned about their future due to our inaction on climate change. The picture on the right shows my dad looking for the first time at the place that his home of decades used to be before it was destroyed in a wildfire in 2017. He's lucky because he's a pediatrician, retired pediatrician, and so he has home insurance and he has the resources to cope with the loss of his home, as well as having a robust support system. Many of the people who have lost their homes in the California wildfires do not have those kinds of resources, and they really don't know what they will do to rebuild their lives. And these kinds of losses are becoming more frequent from hurricanes, from flooding, from wildfires. Next. So summing up with our climate health framework again, living conditions and health inequities increase vulnerability to the health impacts of climate change, and climate change health impacts exacerbate existing health inequities. Next. I don't want to forget to point out that climate change also impacts the ability of healthcare systems to function. Most hospitals are currently woefully unprepared for disruptions in power or for evacuations that we've seen across the country in extreme weather events. Next. So let's turn back to the reports. The next important point the reports make is that the warmer it gets, the worse the health impacts of climate change will be. Next. Every degree of warming counts. Every degree of warming puts more millions of people at risk and increases the frequency and severity of the impacts that we already see in communities across the nation. Next. We have only a very narrow window of opportunity in which to keep global warming above pre-industrial temperatures within a range that scientists consider, quote, safe. That is 1.5 degrees centigrade of warming. That is not a level at which there are no impacts. We're already seeing very significant impacts, and we're at just about a degree centigrade of temperature increase above pre-industrial levels. But each degree of warming increases the chances that there will be climate changes for which humans literally don't have the capacity to adapt. Scientists are forecasting that unless we take action, there will be large swaths of territory across the globe where heat will be so severe, temperatures will be so high Drought will be so severe that people literally will not be able to live in those areas, and has huge implications for migration and conflict. So climate action cannot wait. Next. The International Energy Agency says that without an immediate and rapid acceleration of action, the goal of 1.5 degrees could be out of reach within a few short years. Next. Or in the words of the director of the World Health Organization, we cannot delay action on climate change. We cannot sleepwalk through this health emergency any longer. Next. The good news is that climate actions have potentially massive health benefits. Next. The Lancet Commission on Climate and Health says that responding to climate change could be the greatest global health opportunity of the 21st century. Next. Climate action is needed first and foremost to reduce greenhouse gas emissions, termed climate mitigation, but we also need to prepare for the impacts. For example, prepare for extreme heat and extreme storms. And we need to build climate resilience by reducing the baseline risks and baseline health inequities. Next. What does climate mitigation look like? The Lancet Countdown, which annually tracks dozens of metrics on climate and health, summarizes what's needed. Wide-reaching transformations across all sectors of society, including power generation, transport, food and agriculture, spatial infrastructure, and the design of health systems. These transformations offer levers to help tackle the root causes of the world's greatest public health challenges. Next. Let's quickly explore some of the benefits of climate action. If we increase energy efficiency and switch from fossil fuel combustion to clean renewable energy, we can markedly reduce air pollution and thus reduce respiratory and cardiovascular disease and adverse birth outcomes and all of the impacts earlier. Particulate matter is highly toxic.
Is anyone else having issues hearing Dr. Rudolph? Dr. Rudolph, I think we're having some connectivity issues on your end. Dr. Rudolph, are you still here? Okay, I see that Dr. Rudolph is still on the call. I don't know if she can hear us or not.
I can hear you. Can you hear me?
Yes, I can.
Okay, I'm sorry about that. I live in a rural area and I have very unstable internet, so hopefully we won't have another interruption. So why don't you go on to the next slide and I'll just pick up from there and hopefully you'll be able to keep hearing me. I'll keep my video off and hope that that will help. Thanks. So switching to zero emission vehicles would also reduce air pollution and its health impacts, especially if we start with reducing the number of diesel trucks and buses on the road, as diesel particulate matter is especially toxic. And there is money in proposed federal legislation to electrify school buses, which is really good news. But we need to make sure that the benefits of a switch to renewable electricity and zero emission vehicles are available to everyone. Next. So from my public health perspective, one of the most important things we can do to reduce climate and air pollution is, and to promote health, is to build a less car-centric transportation system and give people, even in rural areas, a real opportunity to walk, ride bicycle, and use public transit to access jobs, schools, and essential services. Next. My colleague Neil Maislish has shown that simply increasing biking and walking from the current average of 4 minutes a day to about 19 minutes a day, that's less than 10 minutes to and from transit stops or destinations, could reduce cardiovascular disease and diabetes by about 12%. That would be a massive public health achievement. Next. Greening our cities and using green infrastructure, for example, for stormwater management, will reduce heat illness, but it will also clean the air, reduce flood risk, improve water capture and filtration, provide places for physical activity and social gatherings, and sequester carbon. Planting community gardens can also improve access to healthy foods. I don't know if any of you have walked along some of the public walkways in Tulsa where they've planted food forests. Next. And changing what we eat and the way we grow our food can improve diets to reduce heart disease, diabetes, obesity, and some cancers, reduce food insecurity, reduce antibiotic resistance, and reduce methane pollution. Methane being a short-lived climate pollutant with a global warming potential about 25 times greater than carbon dioxide. Next. Our healthcare system also needs changing. Hospitals are incredibly energy intensive, and the healthcare sector is responsible for about 8 to 10% of US greenhouse gas emissions. So there's a lot of work to be done in reducing hospital waste, switching health facilities to renewable energy, changing hospital food systems, and so on. Next. So summing up, we see again that by transforming the systems that are largely driving both climate pollution and adverse health outcomes, especially in low-income communities and communities of color, we can very quickly improve health in our communities, reduce health inequities, and positively impact long-term climate outcomes. Next. Because we're already seeing climate impacts, and those impacts are accelerating quickly, we need to pay attention to protecting and promoting health at the same time that we focus on reducing climate pollution. Next, we need to map climate vulnerability and community assets. We need to establish surveillance systems that increase our ability to monitor and track climate-related illness. We need to increase the knowledge base on climate and health through more research. We need to improve public health preparedness for climate-related extreme events. I can guarantee you that none of the hospitals or clinics that had to evacuate in the California wildfires had ever anticipated that that would be necessary. We can also take actions to reduce health inequities so that we reduce climate health vulnerability, and we can learn how to collaborate across sectors to make sure that health is integrated into decision-making about how we shape all of these systems that so impact our climate and our health. For example, we can advocate for the integration of healthy homes in weatherization programs and make sure that disaster evacuation shelters are also serving as cooling and clean air shelters. Next. There's billions of dollars coming down the pike for infrastructure. We can make sure that those infrastructure dollars are used to build more climate resilient communities rather than used only to build more highways that will in fact contribute to transportation greenhouse gas emissions. Next. Once again, we must act with urgency. Failure to take transformative action with great urgency risks catastrophic effects on human health and well-being, and possibly on the survival of human civilization. Next, climate change is a global health emergency. Climate action cannot wait. Next, atmospheric CO2 levels continue to rise and are now at the highest levels that planet Earth has seen. Next, since the time of the Pliocene, 3 to 5 million years ago, when woolly mammoths were still alive. Next, the carbon dioxide and other greenhouse gas emissions that we put into the air today will have impacts for tens of generations. What we do now affects the world that we will leave for our children and our grandchildren. Next, As the Swedish teen activist Greta Thunberg said to world leaders, "You say you love your children above all else, and yet you are stealing their future in front of their very eyes." Next. None of the changes we need will occur without engaging the communities that are most impacted and the general public. Next. Many of the communities that are most impacted by climate change and health inequities are especially vulnerable because of explicitly racist policies that continue to affect them. I mentioned, for example, that historical redlining and urban heat islands map to one another. Housing and land use policies explicitly led to the growth of polluting industries in and around communities of color. Building community power and voice provides opportunities for those with the most knowledge about their communities to contribute to the development of strong solutions that address many problems at once. And if we don't build community power and protect the vote of every American, we will not have the political power that we need to address the climate health emergency. Next. Community engagement, community capacity, community partnerships, and advocacy form the backbone of the political and social will required to protect our health and the health of our children and future generations from catastrophic climate chaos. Next. Communities around the nation and the world are mobilizing. This picture shows some Oklahoma Native Americans in Washington, D.C. Next. And despite the media portrayal of climate change as a highly polarizing issue, the vast majority of people across the U.S. are very concerned about it and want government to act. In Oklahoma, nearly 2/3 think that global warming is already happening. Most are worried about it, and most think that it will harm people in the US and harm future generations. But far fewer think that climate change will affect them personally, and less than a quarter hear about global warming at least once a week. Next. And that's where all of you come in. Our voice as health professionals is critical. People trust physicians and nurses and pharmacists and other health workers. We have a positive message because the benefits of climate action for health are so great. And we are working in the communities that are most vulnerable all of the time. Let's look next at some of the ways that health professionals can engage in climate action. Next. Of course, each of us can do what we can in our own lives. Next, to model climate-friendly practices such as walking or biking instead of driving, reducing meat consumption, choosing energy-efficient appliances, or putting solar on our rooftops. Next, clinicians can incorporate climate information into the patient encounter when appropriate. For example, make sure that asthma patients know about using the air quality index and have access to HEPA filters, or that patients with diabetes understand the risks of heat illness, both for their illness and for their medications. Refer patients to community services such as low-income weatherization or low-income heating and energy assistance programs. Next, clinics and medical offices can put climate and health information in their waiting rooms. Next, there's also many opportunities within your hospital practice or professional organization. Find out if your health system has a sustainability program and get involved. Ask about providing meat-free options for hospital patients and visitors. Suggest to your local specialty society chapter that they conduct continuing medical education on climate and health for practicing physicians in your community. Next, climate action groups are spreading in every state as are community efforts to address health inequities. You can seek out groups in your region, such as the ones that are listed in the resources at the end of the conference brochure, and ask how you can help. Next. Think about writing letters to the editor or op-eds that make the link across climate change, health, and equity so that more people in your community understand that climate change is impacting our health now and that climate action has health benefits. Ask a local radio station if they want to do a show on the issue. Use your social media to get the word out to your friends, family, and colleagues. Next. Many of the organizations that I will list at the end of my presentation can provide help if you want to try your hand at media advocacy. Next. And clearly, we cannot make the systems changes we need without local, state, national, and international policy change. Get to know your elected leaders. They would like to hear from you. Offer to help them understand the climate, health, and equity connection. Form a relationship with them so that the next time there's a climate-related piece of legislation, you can talk to them about why it's so important to take climate action from a health perspective. Use your health professional voice and knowledge to inform their votes. Next. Think about the power that we could have if trusted physicians and nurses in every voting district used their voice to push for climate action to promote health and equity. Next. In 2019, an ad hoc coalition of national health and medical organizations came together to create a policy action agenda on climate, health, and equity. Next. You've already heard the core messages of this call to action. Climate change is a health emergency. Building healthy energy, transportation, land use, and agriculture systems can deliver immediate and sustained health benefits and reduce the future health risks from climate change. Climate action must address persistent health and social inequities. We cannot have healthy people without healthy places, and we can't have healthy places without a healthy planet. Next. The policy action agenda identified high-level priority policies across many sectors, and I've alluded to most of these in earlier comments. Next. It also includes actions to take within the health sector, and it calls for more investment in climate and health, both in healthcare and public health. Next. This agenda was endorsed by about 170 organizations, including many of the leading medical, nursing, public health, and voluntary organizations in the country. Next. And it continues to guide our work in developing more specific policy recommendations that integrate health, equity, and sustainability, and that seek to promote and protect health in the era of climate change. For example, one of our recommendations early on was that there be a new Office of Climate, Health, and Equity in the Secretary's office in the Department of Health and Human Services. And I'm really, really incredibly pleased that that office now exists and it's getting staffed up. And my friend and colleague, John Balbus, is running that office. So that's a first. It's really important. And we're seeing similar changes happening in many other parts of the federal government. Next. Our efforts are part of a global movement of health professionals to address climate change. And I'm not going to show this video because I'm sure that it will collapse my my internet connection. So I'm going to just read you what Dr. Richard Horton said. My name is Rich, and I encourage you to watch the video. I found it very powerful. My name is Richard Horton, and I'm editor of The Lancet. The climate emergency that we are facing today is the most important existential crisis that we are facing as a human species. And since medicine is all about protecting and strengthening the human species, it should be foundational to what we do every single day. The duties of a doctor are first and foremost to an individual patient or the public that they serve. The climate crisis is one of the most, I would say the most existential crises facing our communities and the world today. Doctors and all health professionals have a responsibility and obligation to engage in all kinds of nonviolent social protest to address the climate emergency. That is the duty of a doctor. Next. So I am really thrilled and amazed that so many of you are participating today in a conference on climate change. And I ask that you think about your duty as doctors and nurses and public health professionals and health sciences students and teachers. Our under-resourced health systems have been overwhelmed by COVID in the past several years, but climate change doesn't care about COVID. Without action by all of us, climate change continues to accelerate and its health impacts continue to worsen. Climate action cannot wait. Next. I encourage you to register for the upcoming Medical Society Consortium on Climate and Health annual meeting. Maybe that's on the next slide. And I urge you, I beseech you to find a way to engage. Check out the many resources that are available to help to take action next, and reach out to the organizations listed at the end of the conference brochure. Your voice is really important. Your actions count. You can make a difference, not just for the health of your communities today, but literally for the health of today's children and future generations by engaging on climate change. Next. Thank you very, very much. And I think we have time for a few questions.
Thank you so much for sharing your presentation with us, Dr. Rudolph. That was great. Yes, we have about 5 minutes for questions. If you have any questions, please just start sharing your video, and yeah, I'll just open it up to the rest of the group.
Dr. Rudolph, I was wondering where in hospitals, like what are small changes we can advocate for our hospital to make change towards being more climate friendly?
So I'm going to encourage you to look at two websites. One is there's a organization called Healthcare Without Harm that has really led a lot of the work on reducing waste in hospitals and reducing greenhouse gas emissions in hospitals. And they also have an organization called Practice Green Health that they're related with. They have lots of resources on lots of things that you can do in hospitals. Many healthcare systems are really looking at changing how they source their energy, which of course is their largest contribution. So you can push to do that. Many healthcare systems have a sustainability office, and I don't know if the University of Oklahoma has one. There's a group of pharmacy and medical students at UC San Francisco that have just been really working hard to source local food in their hospital cafeterias and for their patients, and pushing to make sure that there's meat-free options for patients and visitors in every meal. And on the list of resources, I included Medical Students for a Sustainable Future, but you can find that group and connect with students in other health sciences programs that have been doing things like that. You can make your efforts more specialty specific. So if any of you want to become anesthesiologists, you can go talk to your anesthesia department about switching to anesthetics that don't have the highest greenhouse gas emissions profile. So there's many ways that you can track it, can try and make sure that there's options for employees and patients and visitors to get to your hospital facilities without getting in their car. So those are just a few ideas.
I saw in the chat that Kelly Dillo from the Department of Environmental Quality had a question. She wanted to see how can non-healthcare professionals support the healthcare community, specifically in advocating for climate change?
Great question. I think that most health professionals don't really keep track of what's happening in their state regulatory agencies. And often that's the place where really important changes are being made. and the state environmental quality agencies are in tune with what's happening that's going to impact the environment in their other agencies. So I think the most important thing that non-health professionals can do is really help people in the healthcare community know when their voice might be helpful. I rely on people that are working in other sectors to tell me, hey, this regulation is coming up for a hearing. It would be really helpful for us to get some health people to talk about the health implications. So I think that's a really important thing, is just to clue people into what's coming up that's important, that would advance climate action, and give health professionals an opportunity and students to research what health impacts are, and then talk about those health impacts to regulators and electeds.
Well, looks like our breakout session is about to close. So I wanted to thank you one more time, Dr. Rudolph, for sharing your insights about climate, health, and equity. I hope everyone comes away from this presentation with a little bit of an idea of what they can do to possibly help, at least in our state of Oklahoma in the future. So thank you again.
Thank you very much, all.